In this video, my patient has a sacral wound with osteomyelitis caused by methylcoxic-resistant staph A or MRSA. From the MER, I know that the transmission is going to be from skin to skin or skin to object. Therefore, the patient needs to be isolated. We will therefore use contact-based precautions. This involves strict hand cleaning when entering and leaving the room, gowning and gloving up, as well as making sure that there is dedicated equipment in the patient's room and or any equipment leaving the room is going to be disinfected. Using standard-based precautions, I will then wash my hands with soap and water before I start for about 20 to 30 seconds and make sure that all of the crevices in my hands, such as nails and insides of my fingers, are washed and dried. The equipment that needs to be used is a gown, gloves, and face mask. There also needs to be a face shield if it is indicated that the patient has an open wound. I will now start the contact-based precautions such as donning the gown and then gloving up. The best way to glove up is going to be making sure that the gown and the gloves are going to be as one unit, so that way my wrists don't risk getting any germs on them. I will also use the standard-based precaution of a face mask just because in this COVID times we don't want to initiate germs, as well as it has been a bad flu season, so we want to make sure that our airborne precautions are also taking effect. I will then knock on the patient's door and wait for them to tell me to come in and then greet the patient. In the patient's room, I'm going to find a stethoscope and a gait belt solely for that patient. Now for the doffing procedure. First, what's going to happen is my gown and my gloves will be taken off before exiting the room. It's important here to note that the patient has a private room with the door closed, so we want to make sure that the door is closed after leaving. I will then wash my hands again before taking off the mask. Then I will wash my hands one last time before going to go and see the next patient. Again, if there was an open wound, I would use a face shield and then wash off any equipment that I've used, including the face shield, with germicidal product and then dry before another patient use. The CDC recommends anyone with an active resistant infection not be discharged from inpatient setting.